First and foremost, of course, want to thank you all for joining us this afternoon. And not just to thank you for joining us, but for the collaboration and for the contributions that all of you have made throughout the entire course of bringing Senate Bill 245 into law. And as I always remind my former legislative colleagues, to resist the temptation to think that just because you've passed a piece of legislation and put a new law on the books, that all is well and the problem is completely and comprehensively dealt with, because as we know, there's a whole lot of work that goes into the implementation of that law. And in this case, there's obviously quite a bit of implementation work to be done. And your contribution and participation in that process is going to be incredibly important. And so we've obviously tried to design a process here that is collaborative at every step of the way, that we are able to do so via the law. But certainly we want as many folks at the table as possible to help guide this work, to help us make adjustments where adjustments need to be made, and to make sure that we are fulfilling the policy objective and the promise that we made to the parties that negotiated out the compromise that became Senate Bill 245, as well as the legislators and the governor, who obviously did their part to make this a reality. We want to make sure that we're delivering on the expectations and delivering the results that they expect as well. So Michelle has put together a presentation for you today to take you through the different pieces of what up to this point we've put forward, a little bit of what the process is going to look like going forward. And then I know that a lot of this information you've already received, which I think is great. So we'll do a little bit of an overview on the topics that I just touched upon. And then we do want to leave a lot of time for any questions or comments, feedback that you all have, so that we again can, if adjustments or course corrections need to be made, we can start making them right away. So with that all being said, Michelle, are all the gremlins?
Just one housekeeping item, and that is for folks with questions, please enter them into the chat, and we will get to those at the end of the presentation, as the commissioner just mentioned. So please enter questions into the chat. Thank you.
Yeah, and along with that, we're not trying to screen out questions. We're not trying to put any censoring on this conversation. By having the questions in the chat box, we can take them and record them and make sure that we've taken all of those issues into consideration. It's just a good way for us to catalog everything. So I don't want anybody to get the wrong impression as to why we've made that request.
Okay, so reimbursement for ground ambulance services. Let's get started. So here's our agenda today. We're going to do a little bit of an overview of the legislation, its objectives. We're going to talk about reimbursement requirements, the standard contract, and some guidance, reporting and oversight, the applicability, and some final notes. And then we'll get into the Q&A. So the background and purpose of SB 245. So this has been an issue in our state for many, many, many years. And we've been working very closely with stakeholders for the last several years to address the longstanding issue of ambulance reimbursement and balance billing of customers. So this is compromise legislation with a lot of different stakeholders involved. And so we, where we've landed right now is with SB 245. And what it does is it aims to eliminate balance billing and to encourage network participation with health insurance carriers. Its goals are to create a fair, competitive framework for providers and carriers. The key features of 245 are that there's a prohibition on balance billing for insured patients. That means that it's going to be up to the ambulance providers and the carriers to work out what that reimbursement is going to be, and the patients should be taken out of those negotiations. In order to advance that, there's a requirement that a standard contract be developed, and that if there is any willing ambulance provider willing to accept that standard contract, the carrier will have to accept them into the network. With respect to that standard contract, the bill sets an interim reimbursement rate of 325% of the Medicare rate. This is for an initial 2-year period, and then after that, 325% rate will sunset, and the rate moving forward at that point is going to be a rate based on an independent cost study. We have already started the work on that independent cost study with the RAND Corporation, and they are assisting us with that project. It just went through GNC and got its approval at the last meeting?
Yep, just a couple weeks ago.
Yeah, so, but we've already had multiple meetings with them and the work is underway. So keep an eye out, ambulance providers, in the new year. You're going to see more information about that cost study. So as I said, the legislation is setting a temporary 2-year rate schedule. And so that is at 325 or 3.25 of the Medicare rate. That is the Medicare rate that is in place at the time that the service occurs. So there are temporary add-ons for rural and super rural. These periodically are set to expire. Historically, they've always been renewed, but you never know what's going to happen. So currently, they did lapse during the government shutdown. Once the government reopened and legislation was passed, they were retroactively applied back to when the government shut down. But their new extension date sunset is January 31st of next year. So that's another thing just to keep an eye on. If they were to actually sunset, that means that the state set rate of 325 will be adjusted to whatever the current Medicare rate is. Also, to the extent Medicare adjusts those rates, again, these rates will be adjusted to whatever that rate is. So we're just flagging for carriers and ambulance providers that monitor what happens at the federal level, because that could impact those reimbursement rates. This temporary rate is going to be applied from January 1, 2026 through December 31st, 2027. At that point, it sunsets, and that does not mean those contracts, those standard contracts sunset. It just means that instead of getting the 325% under the rate, you would be entitled to whatever that new rate is following the cost study. My mouse has disappeared on me. So we've gotten a lot of questions about this, but just to lay it all out in the system, and how this is going to work is ambulance providers will be eligible to receive that enhanced rate as soon as they submit this form, and there's a link to the form there, to initiate contracting. So they're stating when they submit this form that they're ready to start contracting. Once they've submitted that form, and on the form, we can take a quick look. Hopefully this is up the way it should. Nope, it's on a screen. 1 second. Can you guys see the web screen, or are you just seeing the or the website?
We just see the presentation.
Okay. Well, on our website is the form. On the form, there are check boxes. So when the ambulance provider, it has some basic information about, name, address, NPI number, where, who's in charge of the contract, that type of information, some of those basics to get going. And then there's a check box. So the ambulance provider can check a box for each one of the carriers they want to contract with. This is one form that's submitted through the website. And once it goes through the website, it automatically will be forwarded to the insurance department, as well as the carriers that you have selected in the form. That's what starts the contract negotiation. At that point in time, you are eligible for that enhanced rate. The only requirement is that you continue to work in good faith to get that contract in place. If an ambulance provider goes 60 days without engaging in that process, then the carriers are supposed to report that to the New Hampshire Insurance Department, and we will look into it further. But there's a possibility that you could be disqualified if it's found that you're not acting in good faith in the contracting process. And at that point, you would be knocked down to the 100% of Medicare. However, as soon as you sign that contract and complete the process, you would go right back up to that 325. So the standard contract is a contract we have developed. We worked very closely with all of the carriers. We got all of their ambulance contracts, pulled everything that's common, and worked with them to come up with a standard contract. It's available on our website, what the terms of that standard contract are, but each carrier is going to put that into their own template of what their contracts look like. The terms should be the same though. And the way the standard contract works is if you're willing to accept those terms of the contract, you have to be admitted to the network. There is nothing that prevents you from negotiating a contract that looks different than the standardized contract, but the carrier does not necessarily have to accept you as a provider into their network if you're wanting to negotiate a contract. There's nothing that requires them to negotiate anything outside of the standard contract. But I think for the most part, it's going to be an option for everyone, and that's where you would need to reach out as part of that negotiation process to see where there is an ability to negotiate, what terms are sticking points, and that's how you would progress through that process. If you are in contract negotiations, as long as you're acting in good faith, you will still be entitled to that 325% of Medicare that all enrolling providers are eligible for. If you already have an existing contract in place with carriers, this new law does not override or invalidate any of those existing contracts. Providers, however, may want to transition to a standard contract to take advantage of that increased rate. You should really reach out to your provider reps and figure out what's the easiest, most seamless way to do that. But you can transition to the standard contract. You can either do that by terminating your existing contract and then submitting the form to engage in contract negotiations with the standard contract. However, there may be more efficient ways of doing that. So I would encourage you to reach out to your provider relations team for what, with respect to whatever contracts you have in place. There's no action. If you don't want to change your current contract, you don't need to do anything. Your negotiated rate will still apply. So as these contracts, as the parties are working together to negotiate these contracts, as soon as there is a contract signed and in place, the carriers will need to report that back to the department. And if someone's not acting in good faith, we would also expect that to be reported back to the department as well. So whether that's an ambulance provider who's not actively engaging for a period of 60 days, or if it's a carrier that's not, has everything they need and has not finalized the contract within 45 days, then please reach out to us. You can do so by emailing the ambulance contracting at ins.nh.gov, and we will follow up on all of those reports and make sure things start progressing the way they need to and take any actions within our jurisdiction to take. Why is this all important? Well, and I have the link there, but I think it's still under construction. I didn't check. We're in the process of updating it, but you know, there's a lot of moving pieces with DOIT. The dashboard is ready. It's going to be up there soon. In the next, we were hoping for today, but hopefully by tomorrow it should be up there.
Checking.
It wasn't as of this morning, but maybe it is now. On our website, we're maintaining a public registry of the contract status and rates and eligibility dates. So this is a dashboard that will be set up and allow any carrier or anyone to search by a specific ambulance provider to find out who they are in contract with, or by carrier to figure out who they contract with. So it goes both ways. And you can also select a date. So part of the reason for this is there are going to be a lot of statuses changing. We anticipate over the next 2 years, whether people are coming into contract, whether they're an enrolling provider, or if they do something they're not supposed to and they get knocked down to a lower rate. We're tracking all of that, and we're going to have all that information ready and available on this dashboard, because as claims start coming in for these things, it's going to be a little bit of extra work for the carriers to make sure that claims are processing appropriately. So they will be able to use this dashboard to see what was the status of this provider at this date as they receive claims in, to make sure that claims are being paid out appropriately. So where do we come in? So as NHID, what we are going to be doing is making sure that all the parties are doing their part. So we're going to make sure that carriers are acting in good faith to get these contracts in place, that they are accepting any willing provider, and that they're paying out claims appropriately. If there are any concerns from a ground ambulance provider that this isn't happening, please feel free to reach out to us. NHID is also going to be making sure on the other side that ambulance providers are acting in good faith. You can't just submit the form and get the enhanced rate and then just disengage with the contracting. When you submit the form, you're really committing to accepting that contract, that standard contract. So we expect you to see that process through. If in the midst of the process you decide, you know what, we don't want to do this, that's fine. Just let us know. We don't want to penalize you because you've made that decision that you don't want to pursue it any further. And we needed to keep this dashboard up to date so that claims are moving appropriately. So we really need both sides to keeping us updated as to what's going on and when status is to change. We are dedicated to actively addressing any issues that are brought to our attention and taking a regulatory action when necessary. We're not expecting to have to do that, but there is always the ability to do that. So one of the things we do need to highlight is the applicability. This law applies only to fully insured commercial coverage. It does not apply to Medicare, Medicaid, TRICARE, self-funded plans, and out-of-state plans. We don't have any jurisdiction over those plans, and therefore we're not going to be able to enforce anything with respect to those plans. But for the most part, Medicare and Medicaid already have set rates, and I believe TRICARE may too, I'm not sure. So it shouldn't be an issue with those. I think it's the self-funded and out-of-state plans. Just keep in mind, we don't have any jurisdiction to force them to accept any kind of contract terms. Okay. So some final notes. We have a lot of good information available on our website. There we have a page dedicated, and here's the link to that. Just for ground ambulance services under this bill. It's going to have all of the information you need. We have the standard contract, the web-based form for initiating contracting, and we have FAQs. Those FAQs will be updated as we get more questions coming in to make so we can make that information available to everyone. And if at any point in time you have something to report to us or questions or anything like that, please feel free to submit them to ambulancecontracting@ins.nh.gov. This is an email address we've set up specifically for this law and for these issues, and we will be monitoring it daily to make sure everything is moving in accordance with the law. So I think that brings us to any questions.
Awesome.
So I'm just going to stop sharing so that I can actually see people and look at the comments.
So while Michelle is doing that, last check, we are in the neighborhood of approximately 100 people having joined us today. It is my hope that a good chunk of you have received a lot of these documents already. We've shared them with a number of the stakeholder leaders, I guess we could call them. But I fully appreciate the fact that not everybody probably had advanced review of the documents. We can absolutely make those available to you. As Michelle mentioned, a lot of them are available on our website. However, if you want to be added to the email list for updates as they come out, then I would ask that you avail yourselves of the special ambulance email address that we made available that has the, that was set up by the department. So it'll be the ambulance, what was it, the ambulance services at ins.nh.gov. So use that email account to just say, hey, I'm so-and-so, I'm representing X, Y, or Z, or I work for X, Y, and Z. I'd like my email address to be added to the distribution list. And we can certainly make sure that you get added. Again, we want to be as collaborative as possible. We want as many people at the table as possible. So fully appreciating that that was a high level overview and that some of you may have had a chance to dive into the documents and may have more specific questions than others. Depending on how far we get today, we're happy to do another one of these to answer any questions or allow those who have not had an advanced look at the documents, the opportunity to go through them and answer or ask their questions later. So with that all being said,
let's jump in.
We have a number of questions. I'll ask Justin if he can clarify this. He had the first question, but I think it needs a little clarification. Is there any reason not to select them all? And I'm hopeful, Justin, that you can clarify, and we'll circle back to you what them all are referring to specifically, unless Michelle, you already know.
Let me take a quick stab at this, and then Justin, if I'm wrong, then correct me. I would think that what he may be referring to is when Michelle talked about the checkbox or the standardized contract, excuse me, and selecting the carriers that you want to participate in this program with. So the reason why a particular ambulance provider might not want to check all of the boxes is if they already have a contract with a particular carrier that they prefer over the terms as laid out in this particular program. Now, I don't know how many of you that will be the case for. I would suspect that the vast majority of providers will be checking each and every one of those boxes. But again, there may be a few who are very happy with their current contract with a particular insurance carrier and they want to leave that in place. They can absolutely do that while again participating in the program with all of the other carriers. So I think that's what he's referring to. But again, if not, Justin.
He just said yes.
Okay, great. I got it right.
Yep,
I'll buy a
that's great.
lottery ticket on my way home.
Our next question comes from Audrey, and she asks, what if you had no calls for a provider in 60 days? Will the contract still stand with that provider?
Yeah, I think I'm not exactly sure what you're asking here, but I think when we're talking about the 60 days and not acting in good faith, that 60 days only comes into play if the carrier has requested, some kind of information or your signature or something, and then you've been silent for 60 days and there's been no follow-up and you're not responding to them. That's what we mean by not acting in good faith for 60 days. On the flip side, if the carrier has everything in place to get that contract signed, they only have 45 days to get that signed. And if they don't, then, there's consequences for them as well. So I think that's what we're talking about when we say not acting in good faith. Sometimes these things could take longer based on, the particular situation. But you just need to make sure you're engaging with them. If they're requesting information, if you need to sign something, if you need to provide them with something, don't go radio silent for 60 days.
Yeah, and I will say too that we're going to have a pretty generous definition of good faith. Good faith does not mean all that's left is, to sign on the dotted line. If there's communication that's taking place, excuse me, if there's communication that's taking place, and to Michelle's point, what the hang-up seems to be is you're trying to track down a particular piece of information that the carrier has asked for, or, different sort of life things that happen that can explain why there may have been a gap in communication. That's obviously not going to fall afoul of good faith. You just in the vernacular of our times, you just can't ghost people. You can't just disappear.
Even if it's just giving them an update, like we're working on this, the person is out of town or, they're unexpectedly out or something like that. That's fine. At least there's some communication and you're just not responding. Does the standard contract ensure that all payments are made to the provider directly? No. Well, I mean, that is the law that as you're processing claims, the carriers should be paying directly to the providers. That being said, if the person's plan says that they have, a $5,000 deductible, the services cost $1,000, and the way their contract is the deductible pays first before the carrier is going to pick up the rest of it, and they haven't met that deductible, you're going to have to collect that cost sharing deductible, coinsurance, whatever it is, from the individual directly. That is sometimes a misconception. It's not that the carrier is not paying you, it's just that they're not liable until certain conditions within that insurance contract are being met. And it's not that the claim's being denied, it's accepted. It's just that the reimbursement for it needs to come from the person based on the terms of their contract.
Yeah, and that's the nuance there, but perhaps what fundamentally that question is coming from is, we are aware of a carrier who, when they were not in network with an ambulance provider, when they would pay whatever they were going to pay for the out-of-network provider, that reimbursement, whatever it might be, was sent directly to the individual patient and not to the provider. That practice is now prohibited by state law. So you don't have to worry about that past practice, which is why, if that is what that question was specifically speaking to, it's not included in the standardized contract because it's otherwise now prohibited by law.
Okay, and then request for clarification. If the ambulance company has two different addresses, each located in separate cities, and holds two distinct Medicaid provider numbers while sharing the TIN and the NPI, do we need to submit two separate applications?
Good question.
That's a great question for the carriers. I don't think you need to submit two separate applications, but it's definitely something. There is a comments box in the form. I would definitely flag that in the form because you want to make sure your contract is set up right and loaded into the carrier systems right, so you don't have any claims processing issues down the line. And so if they're only aware of one of those addresses, and they're not aware of this type of situation, those things could get set up wrong. So that's definitely something to flag and discuss with the carrier as you're going through the contracting process.
And Leslie, let me say too, that is a really good question. And we're going to flag that on our end as well, because I want to do a little bit of research. We'll do a survey of the carriers to see what their response to that is. And once we get the results of that survey, we'll pass that along as well. But in one way, shape, or form, you'll have to work with the carrier to hash out the details of that.
How about Anthem? I don't know
about
what that means. They are subject to this. They are a carrier in our market, but there are other carriers. So they're one of the check boxes. Will the slides be emailed out?
Sure.
Sure. We can post them on our website and then that way anyone can look at them. Will the standard contract require New Hampshire EMS providers to offer discounts to out-of-state insureds by allowing insurance companies to rent networks to all out-of-state partners, affiliates, and clients? There are provisions in the standardized contract that allow for that, but do not require it. So the standardized contract only applies to New Hampshire plans. We tried to put in flexibility so that there is an option to have the standardized contract apply for New Hampshire plans, and then they can kind of negotiate these other issues. But that's something to engage with the carriers about. And again, I would highlight that if that's a concern of yours in that text box. So that's part of your discussions.
And I'll just say, Justin, you and I think, have talked about that a couple of different times, and I wanted to provide, in putting this together, we wanted to provide you the flexibility to still be able to work out those issues. We didn't want to foreclose any opportunities for you to hash all of that out.
Can you provide examples of what good faith efforts
I think
we
did a little bit.
covered that? Just make sure the lines of communication are open, and don't ghost people, as the commissioner put it. If a policy such as a self-funded plan is not covered by the minimum payments, are balance bills still prohibited for them? No.
No, and let me just say, I mean, this is, as I think a lot of you know, when the No Surprises Act came along, the reason why it was such a big deal is because while New Hampshire had had prohibitions and protections against balance billing prior to the No Surprises Act for a certain set of services, it didn't apply to self-funded plans. The No Surprises Act, being a federal law, changed that. And so that is what applied to all of those self-funded plans. However, as what brings us here today is one of the areas of the No Surprises Act that there's still a hole in are for ground ambulance. You know, they discovered, the federal government did what we did, which was this is very complicated. There are a lot of nuances to it. There are a lot of different considerations. And so they needed additional time. There was a commission that was put together. Senator Susan Prentice from New Hampshire was a member of that commission, did a lot of good work there. They're still working through that. But it is my hope that once the commission's work is taken up by Congress, that the self-funded plans will have these same protections equally applied to them.
So the next question, the effective date in the standardized contract is defined as the date both parties sign the agreement. For providers who submit the form prior to 1/1 and for whom the rate should apply as of 1/1, this definition won't work. Can we modify the definition to comport with the intent to pay the rate 1/1? I think that might be conflating some things. The effective date of the contract, I mean, under contract law, is the date that the parties assign it. I don't know that we can necessarily change that because there would be no meeting of the minds prior to that. Where we're talking about, you can fill out the enrolling provider, you're getting that enhanced rate as an operation of law and not because it's been contracted for. Once you have the standard contract in place, then it becomes part of the contract. So I think there's some nuances there. If a carrier wants to start paying out an enhanced rate 1/1, there's nothing preventing them from doing that. But without a contract in place, I wouldn't say it's the contracted rate or the effective date of the contract. And I think the effective date of the contract, there's a lot more terms within that contract. I don't know that you necessarily want to backdate it to a point in time where the parties were not necessarily in contract. So there's some nuances there. We did have significant discussion about that internally. And that's kind of where we've landed, is that we feel that when you're an enrolling provider, you're getting that enhanced rate as an operation of law, but once there's a contract in place, that enhanced rate is part of the contract. Okay, are providers aware of the lesser of provisions that they need to bill at least 25% of Medicare to get paid for the mandated reimbursement? Well, I'm not exactly sure what we mean by that. I think when we're talking,
I think he's referring to is if they're not participating, you know, if the good faith negotiation isn't met, that criteria is not met, you had mentioned it gets bumped down to 100.
yeah, I'd have to go back and double check, but I don't believe. I mean, it's a 325%. I don't know that it was the lesser. I don't know. There were so many versions floating around now that I have to double check. I will double check that, Sean, and get back to you. With respect to the out-of-network rate, though, it is the greater of 100% of Medicare or the out-of-network rate. So if carriers have a higher out-of-network rate than the 100%, then they would pay out that higher rate. But I will double check on what the bill specifically says. Off the top of my head, I thought it was a flat 325 and not the lesser of, but I will double check that and put that in our FAQ as well. There's our ambulance contracting, email address, got that. Will the state ambulance cost reporting align with the Medicare Gaps cost study reports for ambulance? We're still working through this, but I think the tentative answer is it's complicated. We're going to have more information about this in January about what we're requesting from ambulance providers. But it's not going to be simply taking the GATS cost study that was done at a federal level and manipulating that data. There is going to be a request for additional information. It's not going to be the extent to which the GATS is done. It's going to be much more narrow, but we're still working with those issues. The RAND Corporation is the entity that was helping out Medicare with this whole study, is very familiar with the GATS information and has done a lot of work in analyzing that. So they're in a very good place to come up with a great concept for our cost study, but I don't believe at this point in time that it's going to look exactly like the GATS. It's going to be a little bit different, but we're going to have a lot more information about that before we roll anything out, and we're hoping to have another stakeholder forum probably at the towards the start of February to update everyone on what's going on and what things look like. Okay, if a policy such as a self-funded plan is not covered by the minimum payments, our balance billing, oh, I think we already got that one. Oh, sorry. It scrolled up on me. Got the email. How often will the registry be updated? It will be updated every Monday morning is where it's set to update. It will include all of the information from prior. So once it's updated every Monday, it'll be up to date as of that Friday before. So it'll have all of the information. So if you're looking at a specific point in time, you should be able to figure out what the rate was for that specific date of service. Will the new cost study continue? We'll have more details about that, what the ask is going to be for that data in February. Okay, so there are some elements of the standard contract that are concerning from an ambulance provider standpoint. My understanding is that completing the online form, but then negotiating contracts terms with an insurance provider will be considered good faith and sufficient to ensure the service is eligible for 325% reimbursement. I think this will.
Yeah.
Yeah.
Yep.
But the caveat there is the 325% is when you accept the terms of the standardized contract. I think if you want to negotiate those terms, you may have to come down from that 325. That's where the negotiation comes in. So if you don't want to budge on that 325, the carrier may say, well, we're not going to negotiate any of these terms then, and you have to take it or leave it with the standard contract. Okay.
Awesome.
Thanks, Justin. If an application was made before 1/1, but the contract is still pending in early 2026, will the enhanced payments be delayed? No, the enhanced payments will be, if you've already submitted the form, and we've already got quite a few in, then come 1/1, you will be eligible for that 325%. And then as those contracts come into place, the dashboard will be updated to reflect that you are in contract, but that should not impact your reimbursement rates unless you had a negotiated rate. And then once that negotiated contract's in place, you would transition to the negotiated rate. So after 1/1 is the effective date when carriers receive the enrollment form. No, so as those forms are going through the system, they are actively being forwarded to those carriers. So there's nothing preventing carriers from starting those contract negotiations right now and starting the process. However, the law is not effective till January 1. So there's nothing requiring them to do that. So maybe 1/1, you will all get a slew of emails in from these carriers, but our hope is that the carriers are going to start working through this process before 1/1. Okay, so for example, if the carrier receives an enrollment form on 2/15/26, that would be the date that they start receiving the 320% of Medicare. Yes. So if you submit the form now, then come 1/1, you get the enhanced rate. If you're still not sure what you want to do and you're evaluating your options and seeing is this going to be a feasible thing for you, and you submit it in April or May or June, whatever the date is, you submit that form. As of that date, you get the 325. On image. up on that one. Is the contract just for emergency ground ambulance? As stated in 3 SB 325? No, so this is not specific to ground for emergency. This is for all ambulance. So there were a lot of concepts that had been floated out over the years, and where we've landed is trying to encourage everyone to get into contract, whether you're emergency or non-emergency. And in order to achieve that, the carrot is that you get this enhanced rate for the next 2 years to encourage as many ambulance providers as possible to get into contract. This applies to all ground ambulance though, and you only get the enhanced rate once you initiate that contracting process. Okay, some contracts are out. Could you ask the carriers to see if they can auto-populate them in the data from the enrollment form? They aren't, or at least not thoroughly. This would be very helpful to municipalities. That's not something, I mean, we can ask them, but I don't know that we can require them to do it. I mean, I think you guys just gotta make best efforts to work through this. But we will put that on the list, to see if carriers can do that. It seems like it should be fairly simple.
Yeah, it's pretty
thing to
straightforward,
do.
the information that's collected.
But I don't know what the contracts look like that the carriers each have. It could have just been an administrative oversight. I would just encourage everyone to take a breath, that this is a very new process. We're doing our best to, make sure this rolls out as smoothly as possible, but this is a lot of new requirements for carriers as well. That there's a lot that they need to do to change their contracts around, to update systems, to update claims processing. So let's take a deep breath, everyone, and give everyone some chance to get into compliance, and don't assume the worst.
And we're all gonna work together.
Yeah,
This will be a process by which all three of us, the providers, the department, and the carriers, will work together. And there'll be issues and challenges that will come up, and we'll triage them together. But we obviously want to make sure that you all are getting the benefit of the bargain. Again, meeting the policy objective that we've set out to try to achieve. So, as Michelle said, manage potential anxieties appropriately, because we're going to be with you every step of the way to make sure that this works. You know,
okay, great. The rate is guaranteed for 2 years. There's too many coming in. Hold on, I gotta scroll up. I lost my,
keeps jumping.
yeah. Okay, the rate is guaranteed for 2 years. Are there different terms of the contracts regarding times evergreen versus timeframes for each carrier's contract? There may be, that's gonna be up to the, I think the discretion of the carriers, how long these are in place. The way the law works is that it is not intended to be this 2 year and then everyone's contracts end. The way it's going to work is the rate sunsets and there will be a new rate put into place through rulemaking, and that will replace the 325 in these contracts. So our hope through this exercise is that we get the majority, if not all, ambulance providers in contract, and that's going to solve a lot of these problems down the line.
As Michelle mentioned, what will happen is 325 will be in place for the 2-year period. Then via rulemaking, a new rate will be put in place, and that rate will be derived from the work of the RAND cost study report. So that's how that will flow and function. Andrew, were you going to say something?
Yeah, we had another question from Chris Tanarillo, who asked, would you need to raise the billing rates to take full advantage of the 325 for commercial carriers if it is below the 325%?
Yeah, and that's why I need to follow up on that one. I just need to double check before I speak out of term. So I will follow up on that one. Were providers given the opportunity to give feedback on the initial draft of the standard contract, or was it just worked out with the carriers? The department was directed to come up with a standard contract. So what we did is we took all of the carrier contracts for ground ambulance, found all the commonalities, and tried to put them all together into one document so that it could be used for all carriers. It was not part of a notice and opportunity to comment process.
But to be clear, the carriers didn't design the contract. That was the work that we
No.
did based on the process that Michelle just described. You know, because we needed to get that work done and it was intense drafting of frankly, a lot of legal language. We had our attorneys take lead on that. And where it was not because of how it had to happen, because of the directive that we were given, because there was not the opportunity for all of the stakeholders to be at the table, we felt therefore it was unfair to have some, but not others. So we just retained that work and did it in-house here at the department. But we certainly did so with an eye towards being as simple and as straightforward and as easy to work through for the providers who have varying levels of experience and comfort with these types of things versus the carriers who, of course, have a lot of expertise within units, within their entities that are more familiar with this. So we were sympathetic to providers in designing the standardized contract.
Does each provider that wishes to participate have to acquire multiple carrier signatures, one form for each carrier? Yes, it is a separate contract for each carrier, entering into a contract with those specific carriers. So it's going to be different documents and you will have to engage with each one of those. So going back to that first question, that may be a reason why you don't want to check off all of them. If that's going to be too much engaging with 6 different carriers at the same time, maybe you start with a couple of them, see how that goes, and then, go further down. Can we hold claims until the contracts are done? No, you need to be billing out claims timely. There's no reason to hold up claims processing until the contracts are done, because that's the whole point of getting that 325% while you're engaging in that contracting. And the rate you're getting paid out on the claims is not, does not correlate to when you submit the claim. It's when was the service rendered. So services rendered in December, you can't hold until January and then think now you're going to get the enhanced rate. The rate comes down to what was the rate at the time that you were entitled to, what rate were you entitled to at the time that the service was rendered. So any services rendered, if you're now an enrolling provider, from January 1 on is when you would get that enhanced rate. And you don't want to hold up your claims because you want to make sure that they are timely processed. If you wait too long, you may get them kicked back as not being submitted timely.
Before you move forward, someone just commented that they were instructed by Anthem to hold claims.
We will make sure carriers know, do not hold claims. That is not how this needs to be done.
Well, yeah, for no other reason that the carrier should not be giving that instruction for the reason that Michelle just said, which is we don't want there to be contradictory or confusing directives coming from the carriers that are then going to create problems for you when you turn around and submit the claim and have the carrier turn around and say, sorry, no timely filing, denied. So we will get to the bottom of that in very short order.
This one keeps coming up, so give me 2 seconds. I know that there was a cut and paste into the chat. I'm not sure where that came from, but I'm looking at the law right now and it does say in 420J21. So it could be that if that was a snippet from our guidance, we may have stated something wrong. I'm not sure where that came from. But in the law, it says beginning January 1. Yeah, that's not the same thing. Beginning January 1, 2026 through December 31st of 2027, participating and enrolling ground ambulance providers shall be reimbursed for ambulance services at a temporary rate schedule of 325 times the Medicare rate that is current as of the date of the service. So I'm not sure that there is that, and I'm not sure where that came from. So if whoever put that in, if you can let us know if we need to update our guidance, we can do that. But you shouldn't have to change your billing rates. If you're in an enrolling or participating provider and you've signed that standard contract or you're intending to, then the rate is 325%.
The cut and paste came from Appendix A of the NHID standard agreement.
We will go back and fix that.
Yeah. No,
That was an oversight.
It's a really good question. And inevitably, there's probably going to be some things that we'll have to adjust, and that may very well be one of them, which is exactly why we're doing this. So we
Yeah.
appreciate that very much. That's incredibly helpful.
And it just goes to show, no matter how many times you proofread something, you always miss it. Okay, so to clarify, if I sign and submit the contract form from the state, I only will be able to get the 325 after the individual insurance carriers? No.
No, just as long as you're in active negotiations.
As long as you're in active negotiations, you're acting in good faith, come January 1, if you've already submitted the form, you're entitled to 325.
And I can assure you that we'll add that to our frequently asked questions document if it is not already. And I will take on the incredibly dangerous task of trying to provide some examples of good faith, perhaps maybe even a definition. But again, what I really want to stress here is we're going to have a generous definition of good faith. Most especially because, as we've mentioned a couple of times, this is all new. We're all in this thing together. So there are going to be issues and little hiccups that come up that are not going to equate to bad faith. We'll figure those things out. We'll work together. We'll smooth it out. But like I said, the easiest definition of not being in good faith is if you're just not returning phone calls, not returning emails, that type of thing.
Yeah. Okay, so after 12/31/27, will claims for services occurring before that date be paid up to 325, even if the paperwork is processed after 12/31/27, or is it subject to the rate, the date of the price? No, so it's again the date that the services were rendered. So up until the very end of the year, you're still getting the 325, even if obviously it's not going to get billed out to maybe the next year. But come 1/1/2028, you will get reimbursed at whatever the new rate is. A form can be signed with an insurance company to hold claims. It will be specific to each provider and include verbiage and timeframes.
So it's
We're instructed.
Yeah, this is what
Okay.
we need to get to the bottom of.
Yeah, I mean, again, if you have negotiated agreement, there's nothing that prevents you from negotiating this, but you're never required to do that. So we will clarify that with carriers and make sure that everyone's on the same page about that.
And I can't see everybody who's on the call, but if somebody from Anthem is on this call, there's your heads up. We're going to be calling you probably tomorrow morning to ask you about what this is, what type of instruction you're giving here.
Yes, Jeff. So it's 325% as long as you're an enrolling provider or you have that standard contract in place.
Yeah. Fran, as I said to you, I'm going to try to do my very best to give you a little bit more guidance around what good faith in this context looks like. I would certainly hope that you would not have to keep logs, but I think not deleting your emails is probably a good idea in the event that we've got to try to hash something out.
Yeah, we're not going to take anyone's word for it. We're going to do our due diligence before we make any kind of finding on that.
Yeah, we're not going
We're
to.
definitely going to be reaching out to everyone.
We're not going to be taking away anybody's 325% rate until we've done a lot of due diligence to find out what's going on and actually establishing that the good faith threshold is not being met.
The meeting is being recorded and we will be posting it, I believe, on our YouTube page.
Probably, Andrew, have you guys decided, are we going to do a YouTube? We're going to send it directly?
We won't send it directly, but we will follow up with all of the attendees and RSVP folks at the conclusion of the meeting, not only to provide the slide deck as a PDF for you, for your reference, but also to provide a link to the recording of the webinar wherever we host that.
That's great. And none of this is secret. None of this is proprietary. So if you get the link and you're aware of somebody who would benefit from it that wasn't able to join us because they couldn't make it or they didn't know about today's event, pass that along. Would love for this information to get out as far and wide as possible.
Okay, so Charlene, we only currently have contracts with Medicare and Medicaid. Is there a list of all NH payers that we can locate? So on that form, it's pretty short. There's only 6 carriers in the markets we regulate that this law applies to that you would need to contract with. And so they're listed in that form, and you just have to click the boxes with who you want to start those conversations with.
That looks like it's it for now.
And we're at time.
All right, so I'll conclude simply by saying this, because there's been, again, a lot of great questions asked this afternoon. I've made a number of notes for myself, things that we'll add to the FAQ in the event that they're not already included. But for those of you who were looking to the future and asking about the cost study, what I will tell you is, and I appreciate that some of that concern is perhaps motivated by some of the challenges that we ran into with the first cost study that we attempted last year. So as with Senate Bill 245, so too was it the case that the cost study that we did last year, well, not the department, we contracted with an actuarial firm to do that study, was legislatively mandated. However, the biggest difference between the first cost study and the one we're about to undertake is that the first cost study had 4 or 5 months, something like that, to actually do its work.
Very aggressive timeline.
It was a very aggressive, very, very tight timeline. The benefit of this particular cost study, of course, is that we're going to have approximately 2 years for it to be done, or a year and a half to be done. So there's a lot more time. There's going to be a lot more opportunity for RAND to look at all of the various pieces of data and information and all of the feedback that they receive. And again, there's going to be every step of the way an opportunity for you all to provide feedback and input for them to consider. Again, we'll ask or they will ask, or we'll ask on their behalf for you all to submit some information and some data to help assist with that study. But we're going to defer in a lot of cases to RAND in terms of what they're going to take in and what they're going to factor in and how they're going to calculate it. And the reason why they've earned a little bit of that deference, for me at least, is because RAND was the actuarial firm that worked with the aforementioned federal commission, of which Senator Prentice was part of. And so the advantage of RAND as our vendor in this case, as opposed to some of the other vendors who might have been interested, is that RAND is bringing to the table all of that previous experience. And so they're going to have a lot of data already available to them. They're going to be familiar with a lot of that data. And what we're going to try to pump them with is a lot of New Hampshire specific data as best as we can. And then they'll take that entire universe of information and do the work. But again, there's going to be opportunities for you to contribute. If there's something that comes up that you think is off, or something that was inappropriately considered, or something that was not considered, you'll have the
Go ahead. Go ahead.
Oh, all right, sorry about that. Again, the gremlins in the technology are
They can't hear you, see you, but they can.
kicking our butts today. So anyway, I only had about 30 seconds left anyhow. So the bottom line here is, I know that there's a lot of interest, potentially some anxiety around the second cost study. I want to assure you it's going to look very, very differently than the first one, because again, the biggest factor that's going to be substantively different is they're just going to have more time to do their work. They're going to have more time to work with all of you, to take in a full universe of information and data, and then get to work on figuring out what the most appropriate rate for New Hampshire is. So hopefully that makes puts everybody a little bit more at ease. I know that there was a question about the Medicaid data set. I'm sure that will absolutely be something they factor in. Now, to Michelle's point, is it going to look exactly the same? Don't know, probably not, but that's going to be okay, because again, it's going to be something that's going to have an eye towards something that's workable and sustainable for all of the parties involved. So in any event, great questions. We'll update the FAQ, email the ambulance contracting at ins.nh.gov if you'd like to be added to the email list. If we start getting a lot of questions that come in after the presentation, we will put another one of these events together so that we can answer those questions, and everybody will get the benefit of of those answers. But for now, again, really appreciate everybody coming out today. Hopefully this has been helpful to you, but we are here if anything else comes up. Other than that, have a wonderful set of holidays, everyone. Be well.